Have you ever noticed that when you're tired, you want to go to this hands-on knees position? A lot of time we call it lazy, but actually we do this as a normal subconscious response because our posture directly impacts our ability to breathe. So in this video, we're going to talk about how that posture and pattern that you're in every single day is either helping or hurting your ability to breathe. Before we discuss breathing, we need to define normal respiration. A couple key things that we really want to think about are the diaphragm and the movement of the rib cage. The diaphragm sits under the rib cage here and essentially follows the border of the rib cage. With normal mechanics, if we think of the diaphragm as this domed structure, on inhalation it should flatten out and descend. On exhalation, it should recoil and dome. So we have this structure that's moving down and up. The ribs are moving opposite to that. As the diaphragm descends, the ribs externally rotate and open on inhalation. And on exhalation, they internally rotate and close back down. So diaphragm descends as ribs open. Diaphragm ascends as ribs close. Now, that's normal biomechanics. The problem with breathing is that so many of us learn this normal breathing from a textbook and then assume that our patients are doing that. In actuality, the patterns and postures that our patients are in either leverages this to happen in a good way or disleverages it. And then they start to compensate and find other ways of achieving breathing. So now let's talk about how different postures affect your ability to breathe. Anytime we throw out the word posture, a lot of people think that the most optimal posture is here. In reality, the best posture is when someone can go here and here and here and here. When someone has the ability to move in and out of varying postures every single day, that person is going to be moving well and pain-free. However, when someone is stuck here, that's a problem. When someone is stuck here, that's a problem. So being stuck and in a pattern all day long is going to yield problems and or dysfunction, and it's going to directly impact your breathing. When it comes to posture on the problematic side, what we're really dealing with is a center of mass issue. You have someone that has a center of mass that's pushed forward, you have a center of mass that's pushed back, and they're both influencing breathing. Let's take forward for the first example. Go ahead, stand up if you can, take an inhale, take another inhale, should be hard. What do you feel happening? A, it's really hard to breathe because we're already hyperinflated, but you should feel that you're getting pushed forward. You're getting pushed on the balls of your feet. The pelvis is going anteriorly. You might feel your low back tense up. When you're in this position, we took that inhale. What's happening at the diaphragm? It should go down. Take another inhale. So we are not only flat, but we are descendant. People live like this. And when you have a patient that comes in and you're trying to restore their breathing, if we are not getting them in a better position and we're doing it here, we are furthering their dysfunction. To improve this type of person's ability to breathe, we need to get them back. We need to shift their center of mass back. When we're in this position in a flat diaphragm, it's synonymous to having a dumbbell here and a dumbbell here. If we have to hold both of them, this one's in a leverage position, this one is not. So the diaphragm has no choice but to be weak. It has to call for help. In this type of pattern, what do you think is screaming? Low back, neck. Not only are we leveraging it from our anterior pelvic tilt, the center of mass pushing it forward, they compress to give us stability, but now we don't have actually a leverage position for the diaphragm to work on. So we call on the low back, the neck muscles. And people start to breathe and live in this pattern, and it starts driving more and more dysfunction. And in order to continue year after year after year, you get more and more and more and more and more. to the point where someone is now in chronic pain. So to fix this, we need to get them in a center of mass that's back. We need to get them in a stacked position and then teach them how to breathe. Now, on the other side of things, we have people that are in this posterior center of mass, and this often happens from being too exhaled. So go ahead, stand up, take an exhale, take another one, take another one. Should get hard, but you should feel yourself getting shifted back. We're more on the heels. We're more posteriorly oriented at the pelvis. We have more of a thoracic kyphosis. The shoulders and head are going forward. We are starting to change our posture. This is going to create problems in the opposite manner. We need to start to actually expand and open up, externally rotate the ribs. So the point of this is that the posture that you're in is either helping or hurting your ability to breathe. But to truly fix the breathing dysfunction, we need to first address position or posture. We can't just drive breathing mechanics because we think it's normal on top of a dysfunctional position. That's where the problem lies, and that's how we don't change someone's ability to breathe. So let's talk about different strategies we can think about when it comes to changing posture or position and improving breathing mechanics. So if you're dealing with someone that's in an anterior pelvic tilt and that center of mass that's pushed forward, go ahead, throw them on the ground, put a dumbbell that's heavy enough that won't really budge underneath the feet, and grab a balloon. What's the key here? We talked about how these people are so hyperinflated from inhaling. We really need to drive exhalation. Not only exhalation, but then pausing. They need to learn what it feels like to hang out down with the exhalation. What's happening with the diaphragm when you exhale? It's going to dome up. The only way, in addition to exhaling, can we get it to dome, aka give it leverage, is that we need to be in a good position. That's where this position and the dumbbell and the balloon come in. So what you're going to do is teach your patient how to move in that posterior direction with a little bit of hamstring. Hamstrings are just going to contract to give you that slight posterior tilt and give you that leverage to maintain it. So I am pulling back with my heels like I'm sliding my feet to my butt, holding onto that and going in a posterior pelvic tilt. From here, all we're going to do is blow up the balloon and pause. Tell your patient to spell the word pause in their head, P-A-U-S-E, as they maintain their position. And then when they inhale, it's going to be a small inhale, and then we continue. It looks like this. Posterior pelvic tilt, grab the hamstrings, keep and maintain that position, balloon in, inhale through your nose, exhale. So we would repeat that for 4 to 5 breaths, maintaining that hamstring contraction, continuing to feel the ribs go down. That way we can start to dome the diaphragm. We are impacting posture. We're getting better breathing. We're relaxing the neck. We're relaxing the back. There's so many things that are happening from this drill. Now, if you're working with someone that's more posterior oriented, a subtle change you can do is can the dumbbell, can the balloon, you can be in a hook lying or a flat position. And what you're doing is make sure they're not overly rounded. They're not here. If they are, we might need to cue them to be a little bit more extended. And then all we're doing is more huffing or fogging the glass breath. So a little bit less of an intense exhale. So it would be, and then we inhale. And then we exhale. So the huffing and the fogging the glass type of breathing just decreases the resistance. So there's less pressure because these people already have enough pressure here. So we're trying to open up more of this bucket handle. And we can do that by getting rid of the balloon. We don't need a ton of hamstrings. Usually they are already efficiently using their hamstrings, but we are going to decrease the pressure with our breath to start to change their respiration patterns.